You'll know when you have a wild woman. She'll practice her craft without boundaries. She is truly autonomous. Her loyalty is only to the family she serves, a midwife who will not allow herself to be held back by a system she didn't create.
This podcast is for the birth keepers who want to grow and change. We are open to learning through self-reflection and supportive community. We are creating this space to explore without judgment. We are remembering we were
Born wild. Hello, everyone. Welcome back to the Born Wild podcast. We're your hosts, Sophia,
Leah,
Allie, Angela,
and Chelsea apparently doesn't want to join us. She's staying in the other room. If you hear some weird chomping noises, I brought my puppy with me today, or more like I was forced to bring the puppy today by my husband. So he is gnawing on a bone. Allie's cringing. She's scared for him.
Yeah, shards of bone.
Yeah, and so we are going to rant today, and Leah has... Oh, do we want to do check-ins?
Yeah, we could do a quick one.
Okay, I have my puppy with me, and I'm not happy about it. I'm terrified of him peeing on the floor of the office. I have a lot of anxiety around his bowels. I don't know why.
You have bowel trauma.
I do. I'm just like, Okay, and my husband, he's raised two puppies. I have not. And he's like, if he starts sniffing the ground, that means he has to go. Well, let me tell you how often puppies sniff the ground. It's like all the time. So we'll see if I can stay present during the whole podcast. But yeah, that is my update. We got a little boxer puppy. He's 8 weeks old, and his name is Chili, because we just kept saying he's such a chill guy. So chilly. He's a little chilly dog. So he's really cute.
He gnaws on a raw bone.
Right, so chill.
It's the only vegetarian in the practice. No, I'm just kidding.
Yeah. What about you, Leah?
I'm trying to buy a house.
Mm-hmm.
So I'm brainstorming ways to make that happen. I feel like it's going to.
Mm-hmm.
Feel very confident, but I'm just looking into different options for financing. I had a birth a couple weeks ago. I'm going to talk about today. So I won't check in too much about it right now, but what else? I got a midlife crisis piercing.
Yes, you did.
Which no one really cares about on the birth podcast, I realize. But
where is it?
It's in my septum. Sounds dirty.
I was going to say, for everyone who doesn't know where your septum
is. In my nose. I'm going to shout out to Nomad Piercing, though. That's where I got it done in San Rafael, and they're really great. So if anyone, what do they say? / Born Wild podcast. What is the like when someone has an ad?
Oh, a sponsor?
Nomad Piercing / Born Wild podcast. They're not sponsoring us, but anyway,
they will after this.
Maybe. But yeah, no, I don't know. All the new things with my body happening. Allie, take it away.
I've been working on switching my.
Hold on. Is
school.
this your first podcast?
It is officially my first.
Welcome,
podcast.
Allie.
I'm like listening to you guys of how do I talk like I'm talking to people, but I'm not. Yeah,
it's hard.
Well, since it's your first podcast, why don't you tell the listeners a little bit about yourself and how you found yourself here?
Okay.
Yeah. And say it with confidence and loud, because
I am confident and loud, like Sophia. I'm training under Sophia, and she's going to train me how to be confident and loud.
Shh, I'm talking.
I have 3 kids that were all born at home, and Sophia was at my second and almost third
like 1.5.
1.5. And that kind of like I then got interested in doula work, kind of like having you there actually. So I became a doula, and I've been doing birth and postpartum doula work for like the last 8 years, and I've been ranting to Sophia for many of those years of my experiences as a doula in the hospital.
Yes, every month she calls me. I can't go back. I'm like, join me.
Yeah, so I'm finally taking the plunge and going to become a midwife.
Yay.
Yay.
Yeah.
Welcome.
So I'm doing a heart and hands class and trying to
Mhm.
stay on top of my homework along with doing this stuff and
And being a
working
mom
on
and
being a mom of 3. Yeah.
Where are you going to school?
That's a good question.
To be
Sophia
decided.
School. National
which one
College
did you
of
decide on?
Midwifery.
Okay.
Nice.
Mhm.
She was unsure. We maybe at some point we could get into like how you made your decision, because I know you went back and forth between a couple different schools. Maybe you
Yeah.
could just say like, why did you decide on that school versus the other schools?
Cost and flexibility
Mm-hmm.
of yeah. I have a feeling that it will be a double-edged sword of being able to be self-paced,
Mm-hmm.
but that means I have to be a little bit more on top of it, which is
Mhm.
also hard for me. So
Yeah. Cool.
Yeah, so I'm just doing school. I go to NMI, so I'm finishing up my foundational modules. I think I have one left to go, and then I can start my enrichment modules and then crank those out. hopefully.
Foundational and enrichment.
Yeah,
These are new
they-
terminology.
They
Fantastic.
change things around, so there's like
Oh.
12 foundational modules that cover like the
The
key
foundation.
points. Yeah, the key points of
Bones.
midwifery.
Things have changed since we graduated from that school. So
Yeah.
So
Cool.
nice. And you started coming to more appointments.
yes,
Mhm.
Starting to get very busy for next year.
And I heard
So
a rumor
exciting.
that your kids get out of school early for 2 weeks,
Yeah,
which
I have
is the
one.
meanest thing
Mhm.
ever.
yeah, it really is.
So we are not being sponsored by that.
We do not recommend
Nor children.
We do
Nor
not
recommend.
recommend that school.
It's the whole district. So, but yeah.
Cool. Okay, Leah, what is the topic you
Okay.
wanted to talk about today?
So I'm going to preface this by saying that I have several, not many, dear friends who are either NICU nurses, or I guess several of them are NICU nurses that also go to that come to births, like just are there for the postpartum, even for low risk normal births. They kind of do both. A couple of them have had home births with me, actually. But so it's just to say, like, I know many who are like wonderful and conscious and really go out of their way to like be kind to babies and, are open to learning and are curious about the latest like protocols and evidence-based stuff. And so I don't want to make a blanket statement about individuals. That's my disclaimer.
Mhm.
That said, holy shit, we have an explicit thing on our podcast, so we
Yeah.
can swear. So I went to a birth as sort of a doula. It's a family that I've worked with for a long time. Like it's their third birth, so I don't usually do births in the hospital, but they asked me and I love them, so I agreed to do it. But it was an example of the care that little humans get when they first enter the world. And what's hard is that I have been at births, like transfers, where the postpartum team, like immediate postpartum, are wonderful. Like I've seen them not do blankets or hats and just check baby's temp, lights dim, really respectful. Like I have seen that, and more over the last like 5-10 years for sure. But I also see, probably more than that, what I would consider child abuse.
Mhm.
And it's like hard to say that, and it's like brought the mood down.
Mhm.
But low risk, perfectly straightforward birth, vaginal birth, unmedicated, and this baby comes out and is like assaulted with blankets and a hat and bright lights and like just so intense. And these are like pink, crying, vigorous babies
Mhm.
who had no indication. And like even we know babies with MEC, like if they come out vigorous, it's not evidence-based anymore to do suction
Mhm.
or even to do vigorous stimulation.
Like the aggressive.
Yeah.
Yeah, like
rubbing.
none of that is evidence-based. But this baby comes out and I couldn't believe it. And I have been at a number of births where baby is crying and on mom and nothing is going on. And mom will start to be like comforting, because that's our instinct as mothers, is like, shh, it's okay, baby. Like, it's okay. And the postpartum nurse be like, no, we want them to cry. And like traumatizing this baby, it's just unbelievable to me that that's still happening. And it's, I think
that you have to do that to open their lungs and all the things.
and it's just, you know, and then, you know, like baby's chomping and, you know, clearly showing signs of being hungry, rooting, and like, you know, they're trying to pull out her placenta. Have you encountered the windmill yet? The windmill.
Where they do like this thing?
Yeah.
Yeah,
It's
I've
just,
seen that.
it's like, I'm
Wait,
sorry.
wait, we should describe it. because
Okay,
we're not.
so
The windmill.
the
windmill.
placenta, there's a window of time, right, between birth of the baby and birth of the placenta that makes providers very uncomfortable in the hospital, because it's when the greatest risk of hemorrhage occurs, because until the placenta separates from the uterine wall and is birthed, there's the potential for bleeding, for partial separation, all of that. Now, most of the hemorrhages are caused by providers' anxiety during that window of time. And I used to really like tiptoe around saying stuff like that, and I just decided that I'm not going to anymore, because I've seen it enough times that, and it's common sense, and anyone that it has a brain and experience in birth work can see that, and it's infuriating. Oh my god, as I get more worked up, Sophia's puppy is getting more and more excited. I know, Chili. I know.
I feel like it's not just like the fear of a hemorrhage or something like that. It's also the wantingness to just be done
Totally.
and leave.
Totally.
And the amount of cord traction I've seen providers like use, when I had one OB that was like literally bracing his foot up against the bed and like yanking so hard that the cord snapped.
Totally.
And this client had a hemorrhage in her previous birth.
Totally.
And just like, well, I feel like there's less fear of OBs because they know whatever they cause, they could fix.
Yeah, totally. Yeah, and so yeah, just going back to that sort of window in time and that motivation, they can also check for tearing once the placenta is birthed, although I've seen providers stitch before it's even birthed, for sure. But yeah, so, and this is like 5 minutes after the birth. It's not like it's been an hour and they're worried about it. And again, disclaimer, I have seen providers who don't do this, and that tells me that it's not necessary. So yeah, so cord traction, or what they call active management, is just routine management. I should stop calling it active management. It's routine management. Even when they've given Pitocin, so they've already intervened to have the placenta come sooner. There's a new, and this is new to me in the last maybe 2 years, is the windmill, where they take the cord and they circle it around to get it to come out. And the first time I saw this, it was hard for me not, and I didn't want to crack up because it like wasn't funny, but I think it was a nurse midwife was like,
It looks
studies have shown that doing this technique, you can't see me because this is a podcast, but I'm doing it with
circles.
I'm doing it with my hands. Clockwise circles, really big, so that the woman feels it, right? So they're already like touching her anatomy.
So they're feeling the cord up against their vulva.
Right. Exactly. No, haven't looked for potential tears. No mention of like whatever trauma that woman has experienced there, and whatever that sensation might bring up for her. But it's the windmill. And it's the newest thing. It's the newest science. I'm sorry. It's just so.
Tell us how you feel.
Infuriating. I know.
We managed to have
This
babies
is not a
up until the
practice
window.
rant. This is a Leo rant.
We should be asking our clients, like, do you want
Would you like the windmill?
We offer the windmill.
yeah, studies have shown
And yeah, it's just, and it's the whole thing. It's the whole picture, so like she didn't want Pitocin prophylactically, which means she didn't want it just in case she might have a hemorrhage. She wanted to wait. She wanted to wait and see. And the amount of interference I had to run for that, this was like 5 minutes after the birth. She was not bleeding at all. Her fundus was firm because of course they have to check, right? They're doing the windmill,
Did she have an IV or a saline lock?
No, she didn't.
She didn't have either. Well,
She
at least
didn't.
that
And this was
you
her.
can prevent the.
It's more unlikely that they'll get Pitocin if they have.
Oh, right. No, she wanted a shot. Right.
Right.
They wanted to give her a
kind of-
shot.
they
And it was
push that
like,
more.
she doesn't want Pitocin. 20 seconds later, is she ready for her shot? So you like bypassing me, talking directly to her when she's like totally overwhelmed and holding her baby.
I'm supposed to be getting that big oxytocin.
Right,
high.
right. And then so I was like, it looks like baby's maybe hungry. Like, do you want to see if baby wants to nurse? Because he was clearly rooting. And she's like, kind of adjusting him to the breast. She's very experienced. He's just learning. And the nurse is like, sometimes when their lungs have extra fluid, they're not ready to eat. And I was like, he doesn't. It's not a problem. And sometimes that helps, actually. Starts vigorously rubbing again. And I just, this is why I can't do birth in the hospital. I can transfer with clients who need to transfer, but I can't voluntarily do birth in the hospital because it's so infuriating. And then I go home and I scream into a pillow. But then, I'll summarize this, and then I want to hear everyone else's opinions and experience. But an hour later, the mom says, it's okay, he just had some fluid in his lungs, and I'm so glad we were here. Yeah. And one comment from the nurse, and that's her story. That's the story of that birth. Everything went great.
Could you imagine what would have happened?
I know. But it's like that, yeah.
It would have been better.
His birth was great, except that he had some fluid in his lungs. And it's just anyway, that's my rant. I would love at some point to interview some NICU nurses who have dealt with this, who feel like they do it and they want to tell us why, or who don't, and how they came to that and how they feel about witnessing that.
We should reach out to your clients too.
Yeah, yeah, for sure.
Okay, sure. That is coming up. We're gonna have a NICU episode.
Okay, ladies, jump in. Take some deep breaths.
Well, I know you. Well, I have turned down ever since COVID hit. I had one last doula client. I was like, okay, after this, no more. I'm not going to tell her no. She's a repeat client. Oh God, dog falling. Repeat client, and obviously I'm not going to tell her hey, sorry, no. And then partway through the whole COVID experience, she was like, I just want to have a home birth. I'm like, that's convenient. But I told myself no more. And I've even had really dear friends who weren't planning a hospital birth. There was a birth center birth. And I'm like, I just can't watch you be bullied by any other provider. Because it's just and she would call me all the time crying about how they were telling her baby's so small, and but then there's nothing to do. Oh no, you're measuring fine, but your baby's really small, and oh yeah, your appetite and your nutrition seem good, but your baby's so small. And yeah, and I'm just I can't be a part of any other birth where there's another provider who's going to trump the mom, because that's I think what it comes down to, scare her about something, yeah. And I know you call me all the time.
The setups is what I call them.
Yeah.
Inductions.
You can really see it coming from a mile away. The induction to epidural, the potential C-section. Yeah. And it really is kind of after 40 weeks, you see the lead up of getting nervous about placentas getting old and unable to
Calcifying. And all
yeah.
that.
Right. Yeah, NSTs every other day, to really work up that fear hard, to push, to set up people into the the intervention hospitalized birth.
Yeah. And I think the thing like that, Leah, you're talking about, like the hatting and the blankets and the lights and the
Rubbing.
aggressive stim,
Yeah.
and it's all just like one more thing to lead the parents to think that they actually needed somebody present, you
Mhm.
know?
Right.
them.
Versus like, we were just here in case you need us, but there's never that there. It always seems like they needed something because
Yeah.
they're doing all the things all the time.
Mm-hmm.
Like, what would that, like, could a baby just be born in transition? Like, has
Totally.
has hospital staff ever seen a baby just be born in transition without needing their help?
Right. And again, I have seen it done.
It can be done.
I know it
Yeah.
can be done. There's an excellent midwife, shout out Hannah, who works at Marin Health, who I worked with at the Santa Rosa Birth Center briefly. And I watched her just sit on her hands and really minimal. And it was the first and only time I've ever seen a provider do no blankets. And just like, it was beautiful. And I know it's because of the experience that she had, but like, she's new at the hospital. Hannah, come on the show.
And
The
don't let them
podcast.
change you.
Well, and they
Don't let
have
them
overseers,
change
which
you.
I think may change that too. Like if they have an
Totally.
OB in the room
Yeah.
or whatever, that's then they have to then
Yeah.
follow the hospital.
Yeah, and
protocol.
the band, that goes on the ankle of the baby, which is like
There's
this
more than
rough
one. There's
plastic.
around the
Tot-
hand and the ankle.
Totally, but it's like this urgency and aggression. I guess that's the thing
Yeah.
is it, and it tends to be nurses who I feel like are older, who I've seen for years and years, and it's just so aggressive. And I think as our practice has evolved separately and then now as a joint practice, I just don't catch a lot of babies anymore. Like, I just don't. I mean, I do if mom's like standing over the tile floor in the bathroom, or if it seems like that support is helpful and requested and consented to. But like, I just feel like so many of my babies last year and this year, it was like water births. Mom tells me when the head is born, reaches and welcomes her baby, or dad does. And it's like barely any lights and just like listening to a baby if we're worried and all of it. And it's like the difference. I don't know.
Well, there's a lack of trust in the birthing person in the hospital in general.
Or the process in general.
Right.
There's like
Right.
so much fear. And I think it would be so much better for many medical providers if they got some kind of trauma counseling or whatever, but they don't. They just keep, and then they'll carry that trauma of a story that they heard from another colleague of theirs, and then that changes how they practice because now they're afraid of that scenario happening to them, and it's just so much trauma that is not processed.
Yeah, it is. I don't know. It's so interesting, and I guess people, when but just a few generations born that way. And just like what that does to people, and we have all of these health issues and,
It has to change the biology.
Absolutely. I mean, it's crazy.
And just being hardwired for trauma.
Yeah.
We could go into if a baby is having trouble of the difference between.
Yeah.
Because that also, as far as child abuse and trauma, cutting the cord and bringing a baby somewhere else to then offer more support.
Yeah, it's insane. It's totally insane. You're struggling with your transition, so they cut off your oxygen,
take you
away from your mom. It's
I mean, she hasn't shared her story here yet. We've recorded it, but I haven't posted it. Actually, by the time this comes out, maybe it will be out. But Gemma talked, she was the mom who had the resuscitation at home. And we talked, I believe, a little bit about what that could have looked like at the hospital. Pretend she hadn't had a C-section, which she probably would have. But even the resuscitation, and the immediate postpartum would have looked so different. It would have, her baby wouldn't have been by her for the resuscitation. There would have been like tons of people working on this baby. The baby definitely would have been in the NICU afterwards, and definitely separated from her. And instead, it was within a foot from her, in my hands with the people around her, that she chose to be there. And then she received her baby as soon as he started crying. There was no, well, we have to monitor him for 24 hours or 48 hours or whatever, just to make sure. It was like, no, he's okay here. Like, as soon as he was okay, it was like straight back into mom's arms. And then like, we just kept an eye and just kept listening. And yeah, like just how different emergencies can look too.
Right.
I just realized I have never clamped and cut a baby's cord to resuscitate them.
Like, why would that even be?
Doesn't make
It's
sense.
only
Yeah,
a priority in the
never.
hospital because they got to get them across the room,
Right. Yeah.
But we aren't taking them anywhere.
That's wild.
Yeah.
Well, in the UK,
Well, it's
they
a
have those
lifeline.
beds, the
Yeah.
little cots that they
Yeah.
attach to the
Yeah.
hospital bed to keep the baby attached.
Totally.
And right.
And I
next
have
to
moved moms for sure. Like, I've had babies with really short cords. Actually, no, I'm not going to amend this, but when I was in Utah, we had a mom who came in who lied about her dates and was very early. And when her baby came out, it was 3 pounds and its cord snapped when it came out. And the placenta was like the size of a hamburger. So that happened, and we did have to do resuscitation, get the baby to the hospital. The baby was fine. But yeah, that would be the only time I've ever seen a resuscitation in the birth center or at home in my practice.
Yeah. We did
haven't
cut
cut the cord.
baby Levi's cord because his placenta was still inside, and we needed to we knew we were going to need to do like a full resuscitation.
Yeah.
And the cord came out limp and flat anyways.
Yeah, totally. No, and I just, even when people do cut and clamp the cord, we keep babies right by mom and, all that stuff. But yeah, it's just interesting. I just realized that I've never done that.
Yeah.
The newborn procedures too in the hospital I definitely have had a lot of nurses balk of like doing the vitamin K injection with the baby on the mom and those kind of things.
Yeah. Very interesting.
So we're not really thinking about the baby's experience.
Yeah. Well, it's like what Dr. Stu says. They want baby in the cot. Is that what he said?
Baby in the bassinet.
Baby in the bassinet.
That's all that
I
matters.
was thinking of the cot thing.
Mhm.
Yeah.
I had a really positive hospital birth experience with a doula client at John Muir in Walnut Creek. And after that, I was like, I have to stop now because I want that to be the last experience that I had. And I don't want to be traumatized again. So we'll just cut it right there.
Yeah.
That will
Smart.
be it.
Yeah. And, transfers is just a whole different thing, but voluntarily. And I think it's different too as a doula because you're working with people who have not educated themselves in the same way and who have gone through the whole prenatal experience that you get from a normal OB. Even a nurse midwife, I'm sorry to say. There are some great ones, and they recommend home births.
Yeah.
And I've gotten referrals from Kaiser doctors.
Yeah. I had a pretty good hospital experience recently, a transfer versus C-section. First the C-section.
The C-section.
And the baby had like high arrests, and I was like, okay, here we go, baby in the NICU kind of thing. And no, they did not. It was at Memorial Hospital, and they were just like, mom was still in being sutured, and dad was like skin to skin. She's like, skin to skin with you is the best thing right now. It'll help regulate, like we'll just keep an eye on things. And
But
I know
why are
that
they doing skin to skin with dad and not to mom?
yeah, I know, like why the baby even left the operating room in the first place.
That's been my experience.
But that was like their,
why are you here?
that was their biggest thing, was like they had heard horror stories of like babies ending up in the NICU for like anything, like they'll just look for any reason to end up in the NICU. And so they were really worried about that. And so maybe they had expressed that. And so maybe they were being a little more aware.
And sometimes too, I totally agree with you about skin to skin with mom. I have had moms who are just really overwhelmed.
Too much.
Yeah.
And they want to hold their baby and be with their baby, but like they're shaking uncontrollably or feeling really nauseous or
Right.
like, you know, so
Yeah.
I think dad is a great option in those cases, but most of the time, mom is the best place.
Yeah.
Yeah. I don't know, it's just really interesting. It's like just a fundamental different. And this was the one I'm talking about was especially brutal. Like I've seen the dim lights and I've had people be a lot more respectful, but it was just like, ugh. And the thing that's so hard about the hospital is that you just don't know. It's just roulette.
Right. Unfortunately, it's these like select few that were like, this was a good experience.
Yeah, for everyone who
Right.
yeah.
Right.
Yeah.
And for everyone who can't see, Angela is the doggy whisperer, and she
I
just
know.
rocked him to sleep.
Tucked him in.
And
he's-
successful transfer into the bed.
He's a little angel. You could tell she's a postpartum doula. No.
Not postpartum, just birth, but I'm a mom.
Yeah, the feeling that it's like roll of the dice,
Right.
You know, and like who your team
What
is,
provider are you gonna have?
and what was their last birth like, you know.
Yeah.
I remember there was a midwife at Kaiser who's like top notch, you know, she's like everyone's favorite. And I had a client who had a horrible experience with her when she transferred in. They were just like talking about like the last baby that went past 42 weeks, because that was this client's experience, and how she died, the baby died,
Oh,
and you know,
geez.
and it's like,
Stop sharing your
yeah, like
trauma.
what?
Doesn't
But
belong.
she's like, you could tell she was like shook, you know,
Right.
the
She's still
midwife.
trying to process.
Yeah, but like,
Not
way
with
to
the next
not
birth.
process with your
Right.
clients, like,
Right.
yeah.
A
Yeah.
doula friend of mine had an OB processing another birth with her at a birth.
Oh,
And I was like, do we need to talk about this
Yeah.
traumatic experience you had with the
Yeah.
client who just had her baby? And like,
Yeah.
so she was like, I was just listening to her and like, you know,
Mhm.
helping her process this birth experience. It's like,
You're like,
maybe there
no.
should be someone on staff for that.
Yeah, you were processing.
Yeah.
Right, exactly. So now you're traumatized.
Yeah.
Yeah.
Mhm.
Yeah. It's like a downer. I just, you know, it was interesting to me just personally too. And I, you know, again, I would love to hear people's midwives, doulas, anyone in the birth world, really. So I've talked about this with clients, and I guess on the podcast probably too, is that like everybody has their own background or motivation for getting into birth work and being a midwife. And people will ask me often, like, oh, do you love babies? Like, oh, you get to work with babies. And yes, obviously babies are great. But like my real passion comes from working with women, because really that's what we're dealing with most of the time. And of course we love the babies that we get to be in their lives before and after birth and all of that. But like, that's where it really, for me, where I get fired up is like, and that's sort of where I started out, was like reproductive rights and body image and just like feminist issues. But I feel like, yeah, like just in the last little bit, I've started to feel this shift of like really like mama bear protection of these babies, you know, and not as a like in the midwife role when we have home births, because I just don't feel that. Like I don't feel like I need to do that. I mean, who needs to? But like, I don't know. But when I'm in the
Do you think it
hospital-
has anything to do with like the surrogacy and being responsible for like someone else's baby? Like feeling like that you spent, you know, almost a year like taking care of somebody else's
That's
baby.
interesting. I
Mhm.
hadn't thought of that. I don't know. Like my first reaction is no, but
Which we
that
should put
makes
it. I'm gonna
sense.
put it on the
I know,
list
we need
because
to
we
talk
haven't
about it.
shared that story yet.
Well, and like what was interesting too, when I did birth their baby, it was, I mean, I don't know, I was kind of out of it, but you were there, Sophia. Like, I do feel like people, like I have a video of the birth and her mom caught her and they were doing cord banking. So I think they cut the cord pretty early, but, and they also, I think, just wanted to get her to her mom, you know, like not be attached to me anymore.
well, and she was she was really early, so she was
Right.
gonna have to go to the NICU. And like, if it had been, what was it,
12
like a couple
hours.
of days? Yeah.
Oh
12
no, it was
If
12
she had
hours.
been 12 hours older, she
She
wouldn't have had to go.
Right,
Wow.
which was really irritating. But I let go of that to an extent. Actually, a lot of it, because it wasn't my baby, and I was
You
like,
birthed in the hospital?
yeah.
But I was just wondering if maybe that like tweaked
No, that
things
makes
for you.
sense. Yeah, no. My favorite, we'll talk about this later. My favorite like video photo of all of that time is like after they took her to the warmer and there's stupid shit to her.
Yeah.
They walked her over and put her in the arms of her mom, and her mom just like puts her head back and is like, and it's just like the sweetest thing. Yeah. So anyway,
I guess we've improved since hospital birth before. They used to swing them upside down.
Upside down,
and
spike
spike
'em
'em
on the
and-
bed.
oh yeah,
Right. So
of
I guess there is
course.
improvement work, but we're
Right.
Yeah, I just wish everyone who takes care of moms and babies in the hospital could see a birth where the baby comes out, the mom catches, and they just like stay together for hours and nobody else touches
not
either of
messed
them.
with.
Yeah.
You know, like
Well, even just
like
I
that
love,
it's possible. I don't think they realize that it's possible.
I love the way you say this to clients too. Is like, I don't put my hands on your baby unless I absolutely have to,
And with permission.
with
and, you know,
permission.
like,
Yeah, but like
that's the thing I get. That's one of my biggest hangups too, is that even in an emergency, there's always time for permission. Like you could always be like, yeah, there's just always time to clue in the parents.
Totally.
Yeah.
I'd like to give your baby some breaths. I feel like it would help them.
Yeah.
Is that okay?
Yeah. They didn't die in the time
And I
it took
have
you to say
never
that.
had a mom be like, no,
right.
I'd rather you
no,
didn't.
thank you.
Yeah. But it makes a difference versus just like
Totally.
taking someone's baby.
Totally. Yeah, even like birth videos that have more of a focus on that, maybe, like so many wonderful women birthing are like capture their births and share it, which is like such a gift for other people preparing for birth. And I think, maybe just somebody like being willing to really like focus on that aspect of it, like there's like the birth and the mom catching and that beautiful part, but like just the baby's experience. I don't know.
Yeah. Good topic.
Yeah. Thanks for letting me vent about that.
Yeah.
It's
That's why we
definitely a
call it
rant.
rants.
Yeah, that was a genuine rant. Right, Chelsea?
Yes. Yep. That was a rant.
Yeah.
Good. Okay. Anyone else have anything else to add? Any more feelings to get out?
No, I don't think so.
I'm good.
Okay. Until next time. Thanks for listening.
Bye, guys.
Thanks everybody for listening. You can find us at Born Wild Podcast on Instagram. For inquiries or feedback, you can email us at bornwildpodcast@gmail.com. You can find me, Emma Ray, on Instagram at Emma Ray, REA.
Sophia at sophiabirth.com.
And me, Leah, at Bay Area Home Birth.
We would really appreciate it if you would rate and review us on Apple Podcasts. It helps us reach more people. And as always,
Stay wild.